Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of May 3rd. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit questions in the comments by direct message or by email to admin@rootsclinic.org. As of May 3rd, 2021, according to the Alameda County COVID-19 data dashboard, there have been 86,080 COVID-19 cases and 1,519 deaths, of which 302 occurred among skilled nursing facility residents. There are currently 84 individuals in the hospital with COVID-19, of which 20 are hospitalized in the ICU. Vaccination rates continue to increase nicely here in Alameda County, and we are now at over 71% who've had their first dose and over 45% that are fully vaccinated. Remember, these are percentages of eligible people, which are those 16 and up. So roughly that equates to about 36% of the overall population in Alameda County being fully vaccinated. As I've shown in prior briefings, the vaccination rates are uneven across the county, but I'm pleased to say that all areas are increasing in terms of their vaccination rates, some more slowly than others, but all are increasing nonetheless. So we are improving, but still nowhere near herd immunity, which is, of course, what we need in order to keep COVID from continuing to spread. And if we can keep it from spreading, we can keep it from mutating, which means we can keep from new COVID variants coming on the scene. Remember that COVID-19 has stayed a step ahead of us or two this entire time. There has not been a time yet through this entire pandemic when we felt we were ahead of COVID. So I do think we can be reassured that California is doing well right now, probably the best in the country. So sure, let's be optimistic, but let's also be smart and learn our lessons from the past year. Every place in the world, and even in the United States right now, that's having a surge was feeling pretty good, kind of like we are now, about how they're doing with COVID. So if you look at Oregon, for example, they were looking pretty good about 6 weeks ago, and now they're surging. And the same thing is happening in Washington State. So we know that this pandemic has kind of gone in waves across the world and across the country. And at this time, what appears to be contributing are some of the more contagious variants. Some of the variants are also more virulent. They're getting people sicker, younger, faster. And we know that this is playing a role in some of the surges that we are seeing in the United States and throughout the world. And we know that COVID-19 does not respect geographic boundaries. And with all of the travel going on, certainly variants can and do travel. And we are particularly concerned about our remaining unvaccinated population and about them becoming more vulnerable as some of these strains become more concerning. But the good news is that COVID has now essentially become a vaccine preventable illness. So we don't have to die from it, which is obviously a huge improvement from where we were just 6 months ago. And progress continues to be made. Pfizer has submitted for approval of its vaccine for 12 to 15-year-olds. And according to a report in the New York Times, it is set to be cleared for emergency use as early as next week for 12 to 15-year-olds. Now, there'll still be some things to work out in terms of how it will be rolled out, how the parental consent will work, especially given that most doctors' offices still don't carry the vaccine, and then how also the prioritization should work. Moderna is also expected to submit for authorization for 12 to 17-year-olds, and then for 6-month to 11-year-olds later this year. So once these are approved, the work of getting young people vaccinated begins, and we'll certainly report out on the recommendations for vaccinating adolescents once those are released. So hopefully within the next week or two. So I think by now we all know a thing or two about getting sick with COVID-19. We know that it ranges from mild or even no symptoms or asymptomatic in some, moderate illness in others. Some go to the hospital to receive oxygen or medications or even to be put on a breathing machine. Some will have multiple organ failure and die. The death rate from COVID in the United States has been about the same for some time now, meaning we haven't gotten a whole lot better at saving lives from COVID. So it's still kind of Russian roulette with COVID-19, with about 1 in 56 of those getting COVID dying from it. So, what about the rest? What about COVID survivors? So, over the past few months, several studies have been coming out about COVID long haulers. Those are the people who survive COVID, but they have symptoms that go beyond the initial period of illness. And several studies are now pointing to an even higher incidence of long COVID than we thought before. We thought it was like 1 in 10, 1 in 6. But all of these analyses are pointing to about a 1 in 3 chance of getting long COVID. So more remains to be learned about this. But what we know now is the list of long COVID symptoms is long, it's very broad, and it's quite inconsistent. For some people, long COVID symptoms are nothing like the original symptoms they had when they first were infected by COVID-19. And the list is really too long to include everything here, but the most common include continued respiratory symptoms, so shortness of breath or coughing, palpitations or chest pain, fatigue, and this is really chronic fatigue. It can be debilitating fatigue, like can't get out of bed, body aches, joint pain, loss of taste and smell. And this loss of taste and smell can happen even with people who did not have loss of taste and smell when they originally got COVID. Also, insomnia, headaches, brain fog. And this brain fog is one of the oddest things, and we really don't understand it. But unfortunately, it's fairly common. People are reporting confusion, inability to concentrate, having a hard time focusing on their school or work. Some people say they can't even focus enough to watch TV. And the severity of this does not seem related at all to how severe the original infection was. So, people with mild initial cases can have significant delayed and long term effects. We've also heard about heart rates accelerating out of nowhere frequently. We've heard about hair falling out. So the symptoms of long COVID are basically all over the map, just like what we've seen with COVID-19 itself. It can also affect just about every organ system in the body, similar to COVID-19 itself. This recent report from the CDC's Morbidity and Mortality Weekly Report shows that they looked at over 3,000 non hospitalized adult COVID 19 patients and found that 2/3 of them had a visit for a new diagnosis within the 6 months following their COVID 19 diagnosis. And they also found that almost 70% had to get a visit with a new specialty provider. And so this is pointing to this cropping up of new symptoms after the initial or acute phase of COVID 19. Now, this was an interesting and very large analysis from the VA that was recently accepted for publication in Nature. And although it's still in the final editing stages, it has been released for preview. And it looks at over 73,000 users of the Veteran Health Administration. And these are over 73,000 individuals who had COVID and survived at least the first 30 days after the COVID 19 diagnosis and were not hospitalized. And then they looked at almost 5 million Veterans Health Administration users who did not have COVID 19 and were also not hospitalized. So that was a very large control group of almost 5 million people, and then the 73,000 who got COVID. But these are all non hospitalized individuals, so not the ones who get the severe illness. And they then looked at what these individuals experienced after that first 30 days of illness. And the results suggest that beyond that first 30 days of illness, people with COVID 19 were at a higher risk of death They used more healthcare resources, and they ended up with a wide array of symptoms as well as lab abnormalities. The diagnoses that they came up with included pulmonary manifestations, disorders of the nervous system and brain, mental health disorders, metabolic disorders, cardiovascular disorders, gastrointestinal disorders, and signs and symptoms related to just overall feeling poorly, malaise, fatigue, musculoskeletal pain, anemia. They also ended up with increased rates of using several different types of medications, including pain medications, including opioids, antidepressants, anti anxiety medications, high blood pressure and diabetes medications, including insulin, just to name a few. They also found abnormalities in their lab tests that indicated issues in almost any and every system in the body. And according to researchers at the Washington University School of Medicine in St. Louis, who examined this data, there was a 60% increased risk of death among 30-day survivors over that 6 month period compared with the general population. So at that 6 month mark, there were at least 8 extra people per thousand who died out of these COVID-19 30-day survivors. And so these are people that would not have died if they hadn't had those complications and if they hadn't had that damage that COVID causes. And this could be anything from heart attack to blood clots, like pulmonary embolism or stroke. And the study also showed that COVID long haulers were dealing with increased anxiety, depression, and increased medication use, again, including antidepressants and painkillers, including opioid painkillers. Now, this is a concern all by itself. Remember, we are experiencing an opioid epidemic at the same time as all of this in this country. And that epidemic has claimed many lives, about 500,000 lives over the last 10 years or so. So, certainly not as quickly as COVID, but still quite significant and preventable. Actually, 81,000 people died of opioid overdoses in 2020. So, we really do need to be concerned about the impact of the chronic pain from long COVID and its treatment as it relates to just the overall survival of individuals post COVID, and also in terms of our overall pandemic recovery. So, all of these data are important, but they're still sort of preliminary, and we need more study for a greater understanding of what's going on. Fortunately, in December of 2020, Congress authorized $1.15 billion in funding over 4 years for the National Institutes of Health to look further into long COVID. And they are looking to answer a number of questions like, what does recovery from SARS-CoV-2 infection look like? And how many people does long COVID affect? What causes long COVID? Why are some people vulnerable and others are not? And I think importantly, does SARS-CoV-2 infection trigger changes in the body that will increase the risk of other conditions like chronic heart disease or brain disorders? And of course, these are real concerns as we try to assess the burden of chronic illness, even among those who survive COVID-19. And lastly, I wanted to mention that there have been many reports and stories about long haulers who got one of the COVID vaccines and their long COVID essentially went away. This doesn't happen with everyone who gets the vaccine, but it does seem to happen for some. And we don't know exactly why, just like we don't know why some people become long haulers in the first place. There are a number of interesting theories that are all biologically plausible. And these are theories about why the vaccine ends long COVID for some people. I won't go through those theories today, but hopefully, with more time and more resources, we will get a better understanding of all of this. But either way, the vaccination is recommended for those who've had COVID-19 because we know that natural immunity is not always strong enough, nor does it always last long enough to offer adequate protection, and certainly not the level of protection that the vaccines do. And so one can get COVID-19 again. And for those with long COVID, they have the added benefit of possibly getting rid of those long COVID symptoms. So there are many options now for getting vaccinated without having to wait. The supply is currently high. We don't know how long that will last, but now is a good time to access any of the three vaccines. And of course, the best way to avoid being a COVID long hauler is to not get COVID. Remember, those who get COVID have a 1 in 56 chance of dying, a 1 in 20 chance of hospitalization, and it's looking like as high as a 1 in 3 chance of long COVID. In addition to the vaccination, our other layers of protection include a properly fitting and good filtration mask, distancing, hand washing, disinfection and sanitization. And within our indoor spaces, the most important thing is ventilation and then filtration. But we really are going to want to continue to avoid crowded, poorly ventilated spaces, whether you're vaccinated or not. But with crowds of people that you don't know, even with masks and spacing, when you're indoors, particularly if it's not well ventilated, at some point you'll all be breathing the same air. And so we are going to want to avoid those crowded, poorly ventilated indoor spaces, do things outdoors if you can. If you have chronic medical conditions or you haven't been checked out for them in a while, please reach out to your primary care doctor. If you don't have a primary care doctor, please get a primary care doctor. Establish care. There's no time like the present. Get that blood pressure checked, get the sugar and cholesterol checked. Do what you can to stay in tip-top shape. Keep up good nutrition and physical activity. Take a multivitamin supplement and add additional vitamin D supplementation. Manage your stress and get a good night's sleep. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10. See you then.
Our Soldiers Against Tobacco advocacy team are working on a smoke-free multi-unit housing initiative to address tobacco-related health issues in Oakland. Our goal is to educate residents about the harmful effects of tobacco use, empower residents to advocate for community health, and decrease exposure to secondhand and third-hand smoke through our smoke-free multi-unit housing policy recommendation for the City of Oakland.
We are recommending that Oakland City Council enact a 100% smoke-free multi-unit housing policy that is fair for all smokers, non-smokers, and property owners.
This policy will increase access to clean air for non-smoking tenants, reimburse property owners for unit turnover costs, protect tenants who are addicted to nicotine from evictions and misdemeanors if they happen to smoke in a building, and overall provide a healthier environment for all families and individuals and multi-unit housing complexes.
Join in our efforts and support a fair smoke-free multi-unit housing policy in the City of Oakland.
To learn more, please contact our Tobacco Policy and Advocacy Program Coordinator, Kiona Parcell Roos at kiona@rootsclinic.org. Thank you.